Welcome, everyone. I am Andrew Duckworth, and I'd like to thank you for joining us for one of our special edition podcasts for the month of November. We hope that you've enjoyed our podcast so far this year and that you're enjoying all the content from our knowledge translation team here at the BJJ, and that we are achieving our aim to improve the accessibility and visibility of the research and studies we publish here at the journal. As part of this, as many of you know, we're producing special edition podcasts. One of these is the Insights from the US series with our amazing guest so far, Professor Heather Valle, chatting about trauma. Professor Matt Abdul's joined us to discuss about adult hip and knee recon literature. And coming up soon is a great chat with Professor David Ring covering upper limb and the importance of the psychosocial factors in our practice. So do encourage you to look out for that coming up soon. The second of our special edition series this year has been with our specialty editors here at the journal. And the aim of these is to sort of give our listeners an insight into the vital work they do here at the journal and what they feel the current research trends are in their area, as well as maybe highlighting some papers from the past year that we have published. So today I have the absolute pleasure to welcome for the first time, not only one of our special editors for general orthopaedics, but also our editor emeritus here at the journal, Mr. James Scott. A huge welcome, James, and thank you so much for taking the time to join us today.
Not at all, Andy. Very nice. Thank you for asking me.
Pleasure. So James, I've asked all our special editors, so I know obviously you're retired now, but over the past 18 months or so, it's been a strange, difficult time for all of us. But can you sort of give us your own brief overview, I suppose, your own insights of the pandemic and I suppose predominantly in your role as a specialty editor for general orthopaedics here at the BJJ and your involvement and how you feel that's impacted things over the past year or so?
Well, there were initially more papers because people were doing less work in the hospital, so they were sending more stuff. And there were more papers that had taken longer time to prepare and they took more time to rewrite. My main role in life these days is to rewrite for you. And it's a very great privilege to do it. And I'm very happy to do it. But I noticed during the pandemic, certainly at the beginning, that there were more papers and they were in more depth and they were very interesting. And they sort of dried up towards the end as people got back to work. Yeah. But the essence, why we rewrite, became highlighted again for us. What is the purpose of this? Are we actually helping? And in what way are we doing it? And other than that, the greatly good work that keeps on being sent to the journal was there for all to see. And that was very, very exciting.
That's really interesting. In terms of the rewriting, has that changed over the past few years? Is it become more difficult? Is it easier? How has anything changed about that at all?
Well, there are many, many things, Andy, which during the last 25 years more that I've been associated with the journal, there are very, very, very many things that have changed substantially and wonderfully for them, and maybe we'll come to some of them. But one thing that very strangely has not changed, well, there are two things in relation to this. One is that that underpins the work of the journal has not changed, if you like, what used to be called the mission statement. So that although your reviewing database is absolutely essential, and you have to remember that the reviewers are the heroes of the whole business ultimately, and of course authors, you've got to be very nice to your authors and encourage them, but the end product, what you get is for the readership. Yeah. And it's very important to remember in all our work, particularly when we're rewriting, that who are you doing this for? You're not doing it for the authors or for the reviewers, you're doing it for the people who are going to read it. And that has not changed. And I'm rather surprised it hasn't changed, because I used to tell Emma that we're going to stop all this nonsense. It takes up much too much time, and you will very wisely cut me off one of these days. And I was absolutely wrong. Yeah. And she was quite right. It goes on and on and on. And furthermore, Andy, what is very interesting about the way in which things have changed in the journal is that the way in which this material is set out has not changed. Yeah. And you would expect, because of all the phenomenal changes that have happened in methodology and statistics and all of that, that maybe we'll talk a little bit about, that the basic thing that you are reading doesn't change, and that is a surprise. So, I mean, we remember one thing, which is that every paper really only deals with one issue. Yeah. And that issue will be in the last sentence of the introduction. The method that they've chosen to ask this question will be in the method, the results will be in the results, and the discussion of it will be in the discussion. And that absolutely hasn't changed. It's a little bit different, of course,
Yes.
with open access material, but basically the readers of the BJJ get the material presented in exactly the same way as has happened through the years. And this, of course, began in 48 with Watson Jones, very, very, very beautiful, clear writing. And that was again and again by John Crawford Adams and by Frank Horan, indeed, who I started with. But the issue then was, I mean, when Frank and I did it, every paper was rewritten twice.
Right.
So when it was decided that a paper was to be published, he did half and I did half. And then it went off to the authors. And when they came back, I did the ones that he'd done first of all and the other way around. Wow. And I thought when I became editor, this is nonsense. Really, all this stuff, it's so time consuming. Anyway, on it goes. And yes. Emma was absolutely right. And it's very important that. And I mean, my guess is that we may be the only journal in the world that allows old fools to tamper with the material on and on and on.
No, I think that's fascinating and really interesting. Like you say, that it's interesting the things that have not changed and that things that hold firm and stand the test of time, I suppose. And I suppose that leads us on nicely. I mean, one thing I wanted to spend quite a lot of time talking about today is how you feel the journal has evolved in other areas over the past couple of decades, because I know you've been involved with the journal for 20, 30 years now, with the editorial board, the editor and the Editor Emeritus now. What do you feel have been the big changes, that you've really noticed, and that I hope often for the better?
All the major changes have happened since I left, I think. I may have been holding a lot of them back, but the changes have been absolutely fantastic and all for the better. I mean, you must stop me if I'm boring, but at the very beginning, my first involvement with the journal was as a reviewer, of course. And in those days, you got a big white envelope with a paper in it to review, and they seemed almost always to come at the end of the week on a Friday. So when you went into the hospital on a Saturday, you took your paper to review and you went to the library, of course, because there wasn't the internet, and you needed to look up all the stuff in the library. But then, now, when I then started working at the journal, the nature of the journal was, of course, very, very, very different to what it is now. I mean, it had a different title, apart from anything else. But the material was very differently done. We had the papers, Andy, were at the front. And then at the back, there was a lot of traditional stuff. There were obituaries, letters to the editor, book reviews, notices of meetings. I mean, just stuff that was very, very, very traditional. And the papers at the front, now that I look back on it, the quality of them was very low. I mean, they were retrospective, they were case series, cohort studies. I mean, they were all observational, and there was an occasional case report, of course, which was very exciting. I used to love putting in case report. And that material all came from a very, very traditional, basic platform of people. There'd be those from America, from the UK, a lot from institutions, well-known institutions in Europe, and a bit from Commonwealth countries in Canada, Australia, and New Zealand. And this was the tradition. This is how it had been for years and years and years. And while during the time that I was editor, the material from America went down quite a bit, partly because of the politics of orthopaedics in American relationship with the JBJS and with the Academy, and partly because of the upcoming separation, which I have to say I was very much in favor of it, and I was sorry in retrospect that it took such a long time. And why was I so much in favor of it? But predominantly because it seemed to us that the American journal was becoming, because of it, the local politics, it was becoming more and more American-centric, if you like. And I wanted to get more international stuff, and Emma was keen to help with that. And I started visiting places, went to India and China, and honestly, the stuff when I first went to see Brad Sekaran in Coimbatore, what they were doing with trauma and with general orthopedics, particularly pediatrics actually, and what George Anderson was doing at the Cushman Medical Center in Vellore with brachial plexus, and that was absolutely wonderful and thrilling for me. And I wanted to get some of that stuff going and generate it ourselves.
Yes.
So that was nice. And then remember that in those days, of course, although it was a general journal, it was very difficult to get material, good material, in the subspecialties.
Yes.
Very few good papers came in hand surgery, say. And I mean, the fact that now there are prospective randomized controlled trials in trauma is, of course, absolutely fantastic. And I mean, I have to note that, of course, started in Canada with Rick Buckley and that lot. Anyway, so it was difficult to get good papers. And what Faris and Emma have been able to do fantastically is to not only increase very dramatically the quality of the papers submitted, but increase them across the board. So that now there are very, very good methodological papers in the subspecialties. And that speaks volumes for them. And of course, started very early on with the subspecialty editors, which was a very, very, very good move. So we have a lot to be grateful to them for. And this also brings to the fore a very, very, very fundamental question about the work of the BJJ, which is, of course, the place of a general orthopedic journal. Is there such a thing? Is it required? Because, you know, specializing much younger and going rightly off to your specialist journals, and is there a need? And of course, what Faris and Emma have been able to do is to show absolutely that they were on the right track completely, and that this journal is completely, wholly, absolutely, utterly needed. And the fact that the impact factor is now more than 5 is fantastic. For a great, wonderful achievement of them. Anyway, so the main ways in which it has changed is that the shape of the whole thing has changed, and the quality has shot up, and all that old stuff has gone, so that there aren't all that all that stuff at the back. Those are all the ways in which it has changed fabulously for the good, and the ways in which it has not changed are that there are old people like me allowed to continue interfering with prized material.
Yeah, no, that's really fascinating, James, how it's been quite a rapid change, hasn't it? You know, even over the past 10 years, the quality of the methodology, like you say, across all the subspecialty areas of orthopedics has just shot up so rapidly. And it's almost a self-perpetuating thing, isn't it? You know, people see it being done, people believe they can do it as well, and they can do it. And it's a snowball effect. And like you say, the quality across the board now is quite extraordinary, isn't it?
Well, I think that most of that has happened in the last 10 years. Most of that has happened since I've gone, and most of that has happened because of various factors. Faris and Emma got on with it. And I had started something, when I was editor, I started something called Reviewers' Days, because I actually, although I'd reviewed a bit, I didn't really feel that I was that confident as a reviewer, or that I knew enough to be in the position that I was in. So I got Reviewers' Days going, and they have been very, very, very successful, as you know.
Absolutely.
And out of those days came concentration on aspects of methodology and aspects of statistics and all of that stuff. And out of those days came the next generation of people like Andy Duckworth, for instance, and Matt and Ben, and I mean all that you know, who have contributed phenomenally to the increase in the quality of the material in our journal, and continue so to do.
Yeah, no, that's very kind. I think you're right. Those research, well, they were Reviewers' Days, like you say, and I remember going on one myself. And now there are research methods and reviewing sort of course, and what they've added is it's really remarkable. So if we sort of move on from the sort of history of the journal, James, I know you've picked a few highlight papers for us, and I just thought we'd sort of touch on these briefly, if that's okay. The first is the multi-center longitudinal observational study from the Netherlands that uses data from the Osteoarthritis Initiative. And that was assessed to assess whether patients with or at risk of developing symptomatic OA of the knee who receive a steroid injection have an increased risk of requiring arthroplasty. And what made you sort of highlight this paper, James, in particular?
Well, I'm very interested, of course, in big data. And I have trouble with big data. When I was editor and starting to get senior statistical advice, the question, how many people need to be asked what question over what period of time to get an answer that will have clinical significance, those sort of questions became very interesting to me, and I had trouble with them. And increasingly, as I needn't remind you, people like Aviva Petri would say every study needs a power study. And if you do power studies retrospectively, certainly on ordinary case series, you will find more often that there are too many patients in the study than there are too few. So I was always suspicious of big data because I was impressed with the statistician's view that only a certain number of people are needed to ask to answer a question. And then when meta-analysis and systematic analysis came along, I thought this must be an answer here. The statisticians, if you pool enough data, you must get something that has more statistical evidence and therefore hopefully maybe more clinical evidence. But in fact, that didn't happen.
No.
And when I was editor, increasingly we got meta-analyses because, of course, they are not so difficult to do, although time-consuming. But the number of times that I looked at a meta-analysis and I said to myself, if we publish this conclusion will change clinical practice, was very, very, very rare. And so I was suspicious and worried about big data. But nowadays, of course, the main issue is that the quality of the data has changed. So, for instance, in registries, we've got PROM stuff, and there's just much more that is of interest when pooled. And therefore, I like this paper because I'm now interested in it, in big data, and it seemed to me that it was a straightforward issue. And what I liked about it was the straightforwardness, that it was large, it was multi-center, it involved PROM data, it asked one question. Does this injection of steroid mean that you're more likely over quite a long period of time to require knee replacement? And the answer is yes. And there wasn't that much radiology involved, and you could think that was a limitation of the paper, but it was very nicely set out. It was better set out after it had been rewritten. It was nicely set out. The question was asked. It was a big multi-center trial, a lot of people. All the data, the PROMs were relevant, it seemed to me. They asked the question and they answered. Does this increase the chance of you needing knee replacement? Yes. And I like that. I just like the simplicity.
Yeah, no, I totally agree, isn't it? Often when you read papers, and we have a tendency to do that because there is more statistical analysis performed these days and everything, but what is nice is when a relatively straightforward question that then is answered. It's very nice that when you read it, isn't it? It makes sense, so to speak. Yeah,
those were always the papers I was looking for, really, as editor. Have you got a simple question? Have you got simple methodology? Have you got rather limited statistics? Have you got the answer? Will it change practice? And that hasn't changed.
No.
And I'm not sure that this will change practice, but I maybe will think twice about it.
Yes. Yeah.
I don't know. I liked it for all those reasons.
Well, I think that's right, isn't it? I think these papers don't necessarily give you the total answer, but they raise the question, don't they? They make people think, and they maybe make people do more research, and that's great, isn't it, in itself? It doesn't have to give you that definitive answer.
Well, and I remember there being an awful lot of papers on this question in the past that were sent to me, and very, very, very few were methodologically sound and were just, as you say, Andy, simple, straightforward. Yes.
Yeah. No, absolutely. So if we then move on, James, I was going to move on to the second paper. That was the one from Japan, and then sort of highlighting sort of the international reach of the journal. And again, it's a multi-center study reporting on 212 cementless Oxford Uni knees, which were undertaken in 174 patients in 6 hospitals, with the aim of the study to determine this when cementless tibial components could be safely used in Japanese patients based on the size and shape of the tibia. I thought this was really interesting. I have to say, I hadn't read this study before you'd highlighted it to me, but I thought this was really interesting.
Well, I liked this for old-fashioned reasons. I remember when I first went to Japan, well, one of the first times I went, there was a meeting of the knee section at a Japanese meeting. And suddenly I saw all this tibia vera in adults with a very, very, very prominent beak sort of thing on the medial tibial plateau. And the rest of the knee was fine. And it seemed that this was very, 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 very common in Japan. And at that time, Andy, we were getting an awful lot of papers about CAD-CAM, all this stuff. The whole future of arthroplastic surgery is going to be transformed by this stuff. You show this joint to a 3D computer model, it'll make a model of what you need to put in its place. And that's obvious. And I thought, looking at this is the answer. I wonder what David Murray's going to do with this funny shape
Yes.
there. And I've been wondering it ever since. And there it is. A very, very, very nice, straightforward paper that tells me exactly what David Murray would be doing with this problem. And I've every so often at night turned over in bed and thought, I wonder what the hell's going on with these Japanese medial compartment patients with OA. And there it is. Again, a very straightforward paper and nicely big centre.
Yeah.
And well illustrated and very well rewritten, and giving you a very simple message. I just liked it.
I think that's right, and it shows that not only the importance of getting data from across the world, doesn't it? And this is, and how relevant that is, and how different potentially practice can be across the world. And that's the great insight for me as well.
Again, you're absolutely right. It's wonderful that all those centres were involved. Yeah,
absolutely.
And that we had it. It was very good.
No, I agree. So if we move on to just the final paper you kindly picked for us, which is actually from some of my colleagues here in Edinburgh, and that was from our shoulder team here, which was a 10-year review of almost 2,500 distension arthrograms for the treatment of adhesive capsulitis of the shoulder. And the aim of that was to determine the efficacy of the procedure and determine, sort of what factors affected recurrence. So what sort of made you pick this out, James?
I absolutely loved this paper for very old-fashioned reasons. I remember when we first got a paper about distension arthrography of the shoulder, and I thought, for God's sake, honestly, but what are we doing? Putting a needle in the shoulder and blowing up the capsule and telling me that's making people feel better. I said, don't be stupid, you lads in Edinburgh. And so I think I may have turned down an awful lot of papers. Anyway, and here it is, who absolutely very, very, very well set out, and you need more. You need 50 rather than 30 mil to get it going, and it absolutely works. And it seemed to be astonishing, and I liked it for all those reasons. And I felt appalled that I felt so cynical and critical about those early papers, and I wanted to apologise to the good Mr. Robinson.
That's very good. No, it's interesting, isn't it? And then I think it's like you say, key take-home messages. If you use this. The arthroscopic capsular release rate was 1.7% across the entire cohort. It's amazing.
Over that long period of time.
Yeah.
I mean, it's absolutely astonishing, because you would think at least the capsule gets stuck back again.
Yeah, absolutely, isn't it? And it's such a, like say again, a simple message.
Yes. And a very simple technique, and it bloody works.
Yeah,
and,
absolutely. Absolutely. No, absolutely.
No, I felt appalled, but I was very thrilled.
So if moving on from the paper, just to finish off, James, what do you see the challenges are ahead? I suppose not only for research, what are our next steps, but also what next for the journal, do you think?
Well, I think the journal is in a fantastically strong place now, and very, very lucky to have you all doing all this wonderful stuff. There are hidden problems that will go on, like open access, for instance, will go on and on and on forever. And I don't know what the answer is. I mean, I suspect that some aspects of open access will be of very great interest to some research workers. I mean, not so much in the clinical field as in the engineering field or the genetic field or the biochemical field, because of the way in which those workers work, they need their answers quickly. And it shouldn't be difficult for open access to answer their problems. And I'm sure that will continue like that. The other issues, well, whether there will go on being a need for a general orthopaedic journal is being answered. How many people will want to be looking at it online, and how many will want to be having it hard copy, that will continue. And I'm not sure that it matters how that argument will turn out. I think that there are terribly important issues that have always been. The one thing that really worries me is the relationship between the journal and training programs. Because there's so much that the journal ought to be involved with training programs, and it just seems too difficult, and you're all too busy. And the time that is set aside, you see, we had journal clubs and all that stuff, which was such fun, and all our bosses came, and God, you looked at the journal carefully in those days, well, quite carefully. And I've always been very sad about that, and I don't know what the answer is. And I don't know, maybe there isn't an answer, but we need to think about the trainees all the way, because they hopefully will be the people who run the journal in the future, of course, and the people who will determine the style of clinical practice,
Yeah, absolutely.
They're
Absolutely.
the future.
They're the future. Absolutely. Well, James, I think that's all we have time for, but thank you so much for your excellent overview of not only the specialty area, but a really amazing insights into sort of the recent history of the journal and how it's evolved over the past few decades. It was fantastic to talk to you, really interesting and informative. And thanks so much for joining us.
Thank you.
And to our listeners, we do hope you've enjoyed joining us today. Feel free to tweet or post about anything we have chatted about today. Thanks for listening and take care, everyone.